COVID-19 hospitalizations in the U.S. reached the highest level of any other point in the pandemic on Monday as a surge in infections caused by the highly contagious Omicron variant strains healthcare systems. According to a Reuters tally, 132,646 people were hospitalized with COVID, surpassing the record of 132,051 set in January of last year. But this time is different.
So now let's talk about the COVID numbers.
Dr. Rahul Sharma, emergency physician-in-chief at New York Presbyterian Weill Cornell Medical Center, says that unlike prior surges, only 50% of his hospital's COVID patients were admitted due to classic symptoms such as difficulty breathing, pneumonia, or low oxygen levels.
The remaining 50% of these COVID hospitalizations are patients admitted for other causes. For example, heart attacks, strokes, abdominal pain, cancer, other infections, but who happen to incidentally test positive for COVID, since everyone that's admitted to the hospital is tested for COVID. Now today, the fact that a large number of our COVID hospitalizations are incidental really reflects the level of community spread of Omicron.
He added that half of those hospitalized with COVID at New York Presbyterian are vaccinated. And while his hospital is already stretched to capacity, the worst may be yet to come.
We'll need to examine the numbers over the coming days, but we anticipate a peak in the next week or two.
Across the country, hospitalizations have increased steadily since late December, doubling in the last 3 weeks as Omicron quickly overtook Delta as the dominant version of the virus. Several states, as well as Washington, D.C., Puerto Rico, and the U.S. Virgin Islands, have reported record hospitalizations. But there is some good news, as Omicron appears to be potentially less severe than prior strains, as Dr. Sharma has seen in New York.
About 10% of these COVID hospitalizations right now are in the ICU, and 5% are on ventilators. Now, as a point of comparison, this is a lower number than during the 2 prior surges.
Deaths nationwide from COVID are averaging 1,700 per day, up from about 1,400 in recent days, but within levels seen earlier this winter.